Welcome to LECOM Health Matters. Our guest today is our good friend, Dr. Michael Hankins, a podiatrist. Michael, welcome to LECOM Health Matters.
Thank you so much for having me.
I appreciate you taking time for what I know is a very busy schedule, but tell us a little bit about yourself, where you're from.
Sure.
So our audience can better understand you.
Absolutely. So I grew up in Memphis, Tennessee. I did my medical training in
Not the great city of Nashville.
Not Nashville. Memphis. Memphis used to be the biggest city in Tennessee until
Really?
Nashville started growing. But I grew up there, went to undergrad there, and then I did my medical training in Miami, Florida, and then I came to LECOM for my residency. After my residency, I went into private practice for a little bit down in Pittsburgh, and then a couple of years ago, I was hired to come back and join LECOM.
It's good to have you at LECOM. We appreciate you and we appreciate what you do.
Thank you.
Just to start out, when a patient comes in to see you, so much has changed in the delivery of medical care. It's like teaching. No more is the faculty member the sage on the stage, where you just sort of like preach to your students in empty jugs that you fill with information and they regurgitate back on a test. Obviously, that's changed in terms of how we teach. How about how you treat and work with your patients? What's different now with you than 10 years ago?
Sure, absolutely. That's a great point, and I see that a lot in my practice. Nowadays, there's so much information out on the internet, and patients are taught by other healthcare providers, and it's sort of in the culture of medicine now to be involved in your own healthcare. So I get lots of questions and a lot of involvement of patients wanting to be like, okay, well, should we check on this? Should we maybe do this? What are my other options? A lot more so than maybe in the past. And I think that's great. I really encourage patients to ask questions and be really involved in their care. I think it leads to better health outcomes.
So when they work with you as a podiatrist, you're really sort of, in a sense, a medical team building between you and the patient, or am I going too far with that?
No, absolutely. A patient is a member of the healthcare team. Absolutely. There's a lot of great research, interprofessional collaboration research that includes patients as members of the care team. Nurses, physical therapy, patients, doctors, administration. They're all a team.
That is so different from really 10 to 15 years ago, when it was really more of a dictated down.
Absolutely.
And people were almost hesitant, if not afraid, to ask questions. Completely different, and I think completely better. But you're a podiatrist, and we welcome you. We want to talk a little bit about feet.
Sure.
I've learned that the foot is made up of 26 bones,
Mm-hmm.
and the foot's one of the most intricate structures in the entire body. I've also learned that we walk about 150,000 miles, give or take, in a lifespan. Don't know if that's true, but the point I'm trying to make is our feet are clearly important.
Absolutely.
But for some reason, we don't take care of our feet like other parts of our body. Why do you think that is?
Well, what do real estate agents say? Location, location, location. So the feet are the farthest part away from your body, right? Our heads presumably do all the thinking for us, and they're the main focus, right? And our heart's here. But the foot is the farthest thing away, right? We kind of take them for granted because you swing out of bed and you just put them down on the ground. They're always out of sight, right? And particularly for some of our, elderly patients or patients that have medical comorbidities that affect their eyes, some people may not even be able to see their feet because they are, if their eyesight is poor, that's, depending on how tall you are, several feet away, and maybe your vision gets a little hazy there and you can't even see, or you can't, you don't have flexibility to see the bottom of your feet. So it's easy to get out of sight, out of mind.
I think that is true when it comes to feet. And a lot of times it's sort of out of sight, out of mind. You put a pair of socks on it, that's it, and off you're done.
Yep. And a lot of my patients are diabetics or have a type of neuropathy, which is where you can't feel. And my patients don't have sensation. They can't feel their feet. So they can't know when a problem starts brewing because they don't have sensation. They can't feel. Man.
Speaking, doctor, about problems, like we've said earlier on, we have to be more attentive to our feet, because if our feet go bad, it's impossible for us to walk around and to do things and to live the life that we want. So paying attention to those critters on the bottom to take us from A to B is clearly very important.
Sure.
But when I look at my feet, and this is going to be a dumb question, and I apologize for even asking.
I love dumb questions.
Okay, then good. I'm the dumb questionnaire. When should I call you? When should I really begin to worry? If it's not outright bleeding or infected,
So,
you don't want to get to that point. And
I
I don't want to usurp your time either.
No.
So what's the trigger in a sense, or what should I look for, or what should the audience people look for that, hey,
Yeah.
I got to give Dr. Hankins a buzz?
Sure. Well, the first thing I'll say is that I encourage my patients to call with any questions or concerns because, again, I mentioned diabetics as a large part of our population. Problems can go bad very quickly. And so time is sometime of the essence. You have to see it right away. But I will secondly say that, pain is not normal for your feet. So if you are having discomfort, pain, however you want to say it, that isn't normal and you should get it looked at. Generally, anything that changes very quickly, if your foot's totally normal one day and then a couple days later you start having some swelling, it's different. And, that's not normal for you. So you should get it checked out. And
people should not be hesitant to call.
No, not at all.
When they sense pain or when they think their toenails are a different color than they think they should be.
Anything that's out of the ordinary. It's the worst case. We can look at you and say, hey, you know what? There's some sock lint on there. It's not a problem at all. It's, but at least we checked it out and we're preventing worse health outcomes, like something more serious, When it comes to people who suffer from diabetes, their foot care is really critical, is it not? Correct. Diabetics should have at least a yearly foot exam. You're seeing your primary care doctor at least yearly as well, but it's recommended from the American Diabetes Association guidelines to see a podiatrist for a foot exam to assess for neuropathy, the loss of sensation, as I discussed, and for deformities or foot problems that can make you more predisposed to a wound or damage to your foot. Why is a doctor that is it circulation's bad in the feet, or that they're the lowest, furthest extremity? So, circulation can sometimes be a concern in diabetic patients, but that's not necessarily caused by the diabetes. A lot of those problems go hand in hand. But it's really a lot of times we find it's the neuropathy is the loss of sensation. What's the most common foot issue that you see? The most common foot issue? It depends on if we're talking about a musculoskeletal complaint like foot, whatever. So plantar fasciitis is very common. Heel pain is the most common cause for heel pain. But I would say with our practice here, it would be a diabetic foot exam, calluses, or dystrophic or fungal toenails. That's probably a really very common thing that we see. And you take good care of them, and no foot is ugly, correct? Exactly. No ugly feet. No ugly feet. No. We talked a little bit about diabetics and about older adults. How about children? I mean, I think. Yeah, I see. Because they're growing, you think, they'll grow out of it. So that's an interesting point. A lot of so I do see children in my practice. See, I'm not surprised to hear that, but I am surprised to hear that. Yeah, no, children have feet and they have problems too. They do have different problems than adults. A lot of problems that children exhibit are typically related to growing, because that's what children do. They're in that early growth process of their life. And to your point, a lot of things you sort of do grow out. Parents a lot of times are often concerned about, they're really flat-footed or they're kind of walking a little bit funny. And so depending on the specific problem, a very common thing for, the 5 to 7, 8 year old, or maybe even a little bit younger, but is something called toe walking, where the child will walk on the tiptoes. They walk with the heel not touching the ground. And, there are some variability, but generally if there are no other congenital deformities like cerebral palsy or musculoskeletal problems like that, the child does learn to walk out of it, so to speak. Yeah. But children are clearly welcome. If mom and dad thinks that there's an issue, think that there's a problem, think that whatever, they should not hesitate to call. Yeah, I love seeing kids in my practice. I love the variety of it. So it's great to see some of our elderly patients, and then I see some diabetics, and then I'll see a kid, in my practice. I like that. Really, as a podiatrist, you're seeing the whole range from youngsters to teens to middle-aged to older folks. Everybody who has 2 feet. Everybody who has 2 feet. Maybe don't, unfortunately. Oh, you see those too, sadly. People have an amputation problem. I do amputations myself if we needed to provide surgical care for my patients. And sometimes we do have patients that have had amputations, and then it's that more important to protect the other side, right? So their care is escalated. If a patient, you said you work with a wound care. If a person has a serious wound on their
foot, they should come and see you too, should they not?
Absolutely. I think all wounds are serious.
They're points of
to your
infection.
point, right? Yeah, exactly. It's your skin is a barrier against infection and protects you. So any rupture in that barrier is a source for infection, and we want to get that healed up before you can get a more serious problem going.
And again, coming to see you to treat a serious foot wound is part of the portfolio of services that you offer.
Absolutely. Yeah. If you were to come to my office just for initial consultation, and I thought that you would benefit from maybe some advanced wound care, that I couldn't provide in my office, I could get you onto the schedule at the wound care center.
I'm curious now, what type of advanced wound care for the feet would you provide at the wound care center?
So we do, it's the standard of care for a plantar, which is the bottom of the foot, ulceration for any neuropathic patient that doesn't have sensation, but most commonly diabetics, is to put them in what's called a total contact cast. And so we offload the wound by putting the normal dressing, but also padding around the wound so that, and then a cast so that they can walk on their foot still, but the wound itself is sort of floating in space, and it allows the wound to heal while they go about their day normally. Otherwise, we'd have to keep you off of the foot and, have you hold it up off the ground all the time, and that can be difficult.
What else might you do in the wound care center?
So if the wound has been chronic for a while and it's not responding to the standard of care or sort of normal dressings and things like that, then we could apply for to apply what's called a cellular tissue product, which is, we sort of call them skin grafts, but there's many different types, varieties, depending on what the etiology of the wound is, so what type of wound it is, and then what we think might work best in that situation.
Would you use the hyperbaric chamber at all for foot?
I do, yeah, that's another thing.
And what is that? I've always wondered precisely what that tube is.
Sure, yep. So the hyperbaric oxygen chamber is it's a big tube. It's a chamber that the patient goes into. It closes up and is a very contained space.
Even the whole person goes in there.
The entire person goes in. They close
big,
it up.
small, little, in they go.
Yeah, well, has to be the right size, but one size fits all pretty much usually. We get you into the tube, close it up, lock everything. It's clear, by the way, so you can still see what's going on. And then we pressurize that. So we increase the pressure inside the tube to a level of up to 2 atmospheres, I think. And they call it diving because this technology was really first made popular by sea divers who had issue with decompression sickness. So they came up from diving
They came up too quick.
Yeah. And so when the divers were down there, they got used to that atmospheric pressure. And so they would put them back in the tube to bring them in the chambers to put them back under that pressure and slowly let it up. That helps the body acclimate better. Well, what they found is putting a patient with a non-healing wound that might need more oxygen to the wound and to their body itself, putting them under that pressure it sort of pushes oxygen into the wounds and into their body. And it makes the wounds heal faster.
Is that a painful process?
It is generally not painful at all. It's the most common thing is sort of that if you've ever flown, you get that like sort of pressure in your ears.
Pressure in your head.
So you do you close your nose and do the little Valsalva maneuver and push out, and that helps sort of release the pressure, right? As you're going down, or they're increasing the pressure in the tube.
Well, that's interesting. I know we have that, and I know the Wound Care Center has been doing a lot of work for a lot of patients over the last year or so. It's really increased its volume.
Yes, a lot of my patients are using it. Unfortunately, some that have needed surgical amputation and cleaning wounds up. We've gotten them into the tank, and that we call it the tank because it's closed up, and that helps really speed up the wound.
It's good to know.
We've healed a lot of wounds with that.
I want to end on this note because I think it's important. We've talked about feet, we've talked about foot disease, we've talked about wound care. How does one make sure they keep healthy feet? What are things I should be doing in my day-to-day bathing, whatever, to make sure that, no offense, I don't have to come and see you?
Absolutely. I love it. I love that. Yes. Great question. So obviously bathing, keeping your feet clean. When you do shower, make sure you clean well between your toes and everything, but also dry well. Making sure you don't leave moisture between your toes. That can be a source of irritation in your skin, and sometimes, superficial fungal infections or even bacterial infections if it does rub open a sore. Doing a daily or, maybe at least every few days, actually inspecting your feet. And if you can't see them yourself, using a mirror to visualize that there aren't issues, or having if you have a partner or a family member that can check for you, just doing a once over to make sure everything looks well. And then aside from that, good supportive, comfortable shoes. I usually recommend that. I wouldn't recommend, walking around barefooted, and certainly not outside.
Not now.
No, not now with it being cold. But I've dug a lot of glass out of people's feet from walking around barefoot over the years. So
how about moisturizing feet, especially in the winter?
Yeah, absolutely. So the air's a lot drier, so keeping a good moisturizer on your feet.
Almost anything off the shelf, really.
Yeah. There's a lot of good products out there. I recommend like a good lotion or a cream, something like that's going to donate moisture to your skin. So daily is good as long as you're not putting it on too much. You don't want to put
too
it on,
much of a good thing.
Exactly, too much of a good thing.
Too much of a good thing. And so basically, common sense when it comes to foot care goes a long way. Keeping your feet dry, making sure they're clean. Toenails?
Yeah, making sure they're trimmed appropriately. We generally recommend for people when they're cutting themselves to trim straight across, not to dig into the corners. That can
cause infection. I can speak to that one.
And yeah,
right? I can speak to that when you're trying
painful.
To round it off.
Exactly.
It hurts.
Yes. So you risk, getting a little nick, and then the nail grows in after that.
That's right.
And then just, making sure that you don't cut the tip of your toe either, with the nail clippers.
Now that's fascinating. You say cut level or cut across and ignore the ends.
Sure. Well, that's because on the edge, sometimes they do a little piece, a little sharp edge, and then that can grow into the side of the toe, the nail fold. Yeah.
Well, Dr. Hankins, I want to thank you for your time. I want to thank you for all you do to help us make sure our 2 feet stay well and healthy.
Thank you.
Thank you for your time. This is Monsignor Rubino for LECOM Health.